So Jessie Wong is a PhD and a licensed psychologist and clinical scientist in Stanford University's Department of Pediatric and Diabetes and Endocrinology. She received her PhD in clinical psychology from Arizona State University and completed postdoctoral fellowships in health services research at the VA, Palo Alto, Stanford University, and pediatric psychology at Stanford University. Dr. Wong is the recipient of a K23 Patient-Oriented Research Center Development Award from NIDDK, which is the National Institute for Digestive and Diabetes and Kidneys. What is it?
Digestive
diseases and I don't know.
Digestive disease. Yes, I believe so.
I think so. Her research and clinical interests focus on the intersection of physical and mental health among children and adolescents with diabetes, as well as interventions to improve the quality of life among these children and adolescents and their families. And I had the great pleasure of working sort of next to Jessie when I was at Stanford in person a long time ago now, it seems. So
thank you so much, Marissa, and thank you for having me here today. I'll start sharing screen now. Is that good?
Sounds great.
Great. And thank you all so much for coming on this Sunday evening of the new year. I'm really excited to be talking about this at the end of this holiday weekend and the first week of this new year that's going to start. And if anyone has any questions or anything along the way, please feel free to ask them either in the chat or the Q&A, because I really want to make sure that the information that's presented is as useful to you all as possible. All right, so today I'll be talking about diabetes and mental wellness in 2021. And I just want to start off by saying that there are a lot of barriers and stressors right now that can make mental wellness challenging, and that currently the rates for depression, anxiety, and substance use are incredibly high. But it's okay because 2020 is over, as Marissa and I were discussing, and there are ways to be trying to cope with all the stressors in our lives right now, and ways to kind of take this idea of a traditional New Year's resolution and translate it into achieving balance and contentment on your own terms, which is what I want to help convey today. So first of all, I want to acknowledge that COVID stress and restrictions are especially challenging right now. I imagine many of you are from different parts of the country, but in general, this is the third major surge of COVID-19. And so a lot of people are experiencing COVID fatigue, which is burnout from statistics, guidelines, and restrictions. Also, the cold weather right now makes a lot of these things more challenging, particularly trying to gather. And then also the holidays added a new dimension of stress and grief, of trying to figure out, making decisions about whether or not to gather, missing friends and family, and kind of grieving past traditions, even if you can hang on to some of them. Everything's just a little bit different right now. So I want to first start off by saying that worry for yourself and your family right now is completely normal. And part of that's because making decisions on how to balance safety with work, school, and quality of life is more challenging and complicated than it's ever been. And there's changes in employment status, work, school, and daily routines that we're just constantly trying to keep up with. So meeting the basic needs of yourself and your family can be really complicated. And that includes, scheduling medical appointments, deciding whether to do in-clinic or telehealth, trying to figure out telehealth, trying to make sure you have all the prescriptions you need, testing, also things like distance learning, and even grocery shopping is just a lot different and more complicated than it's ever been. So I want to kind of think about this stress. It's not all doom and gloom, but think about it in context. And this is a diagram that I really love to share with people, because the extent to which stress functions in our lives depends on the amount of stress that we have. So if you can see here on the bottom axis where it says arousal is kind of another word for like biological stress. So if you have a certain amount of stress, it can actually make your performance improve. So if you think about when you have a really tough exam, having the energy to study for it and being able to focus during, stress helps you with that. And so you can actually achieve optimal performance when you hit that optimal amount of stress or arousal. But what happens is once you get over that hump, your performance starts to decline. And that's because the stress starts to take over. If you're too stressed, you can't concentrate, that you might worry excessively about certain things that you might not be able to change. And as a result, not only does your performance go down, but your mental wellness goes down as well. So we don't want to think about stress as being inherently bad, but really think about what is your optimal zone when it's the best amount for you. And some signs that you might have gotten over that hump can be feelings of numbness, disbelief, anxiety or fear, changes in appetite, difficulty concentrating, challenges with sleep. And this is a tricky one. When your life routine is kind of out of whack, it's hard to tell whether your sleep's impacting your mood or your mood's impacting your sleep. And usually both are true. Also physiological reactions like headaches, body pains, stomach problems, rashes, a worsening of chronic health problems, having anger or short temper, and then using substances. Other symptoms of distress can include fatigue, other types of illnesses, feeling on guard or easily startled, withdrawal from activities or interactions with people, feelings of guilt, irritability, and that's a huge one that people often overlook, and then also excessive worry. And the most important thing here that I hope each of you can reflect on is to think of what are the symptoms of stress that you tend to experience? Because usually people don't experience all of these or all at the same time, but kind of knowing for yourself, what are the earlier signs that I'm starting to have some distress? And then what are the later signs where, wow, I can't even get through a day because my distress is so high? What does that kind of look like for you? Because in order to kind of take this information into practice, no one knows you like you know yourself. So really thinking about what that looks like for you is the key to kind of helping yourself cope through it. And then I also wanted to discuss this in the context of diabetes, distress, and burnout. So as you may have heard these terms before, but I thought it would be worth redefining, where diabetes distress is tension, fatigue, or a sense of being overwhelmed with diabetes self-management. And then an accumulation of distress can lead to what we call diabetes burnout, which is an all or nothing thinking and lack of interest or motivation in engaging in any diabetes management tasks, feeling like I'm completely over this, I can't do one more thing, I'm just done. And just so you guys know, these are extremely common things for people to experience, whether you're living with diabetes or you are helping care for someone who's living with diabetes. And that at any given time, about 20 to 30% of people living with diabetes or caring for someone who does will experience diabetes distress. And that rate's even higher if you look at someone over their lifespan, whether or not they've had distress. And some factors that can impact this are duration of diabetes, age of diagnosis, responsibility sharing. So is one person doing everything, or is it kind of being distributed across people? Support systems, access to care, and also access to diabetes technology. So that's kind of like the signs of things are not going so well. What are some signs of mental wellness? What are we kind of hoping to achieve during this new year? Well, some signs include feeling present in the moment, enjoying pleasurable activities, connecting with others, self-compassion, meaning if you make a mistake, you forgive yourself and you have understanding for what you're going through. So kind of self-kindness and understanding. And then also just general patience, calmness, and forgiveness for others as well. And then also, this is really key, a sign of mental wellness is having a really high tolerance for the stressors that might come with diabetes, work, school, family, or others. So I think, I don't know about you, but for me and a lot of people I know, there have been periods that have been really stressful during this pandemic. And some of the signs can be like you just have zero tolerance for that coworker who made a mistake on something, or your child spills their milk and you're kind of all over the place, completely lose it because of it. That's kind of some of the signs of having a low tolerance. So you know you're doing pretty well if things are going not so great in a certain area or at a given moment, and you're able to kind of work through it. So again, I ask each of you to kind of take a moment to think about what mental wellness looks and feels like for you. You know, I think oftentimes for me, it's that patience and forgiveness for me that I know I'm doing pretty well when I see myself kind of exhibiting those traits for both myself and those around me. So let's talk about some coping strategies. So how do we get from there's going to be times when we're stressed out, that's part of life, to maintaining or achieving mental wellness? Well, the first steps, like I mentioned before, is to be aware of your own stress levels. Know what are the early signs that you're starting to experience distress, whether it's diabetes specific or in general, and then know when it's time where, wow, this has actually gotten pretty high and I'm going to need a little bit more help with this. Another important step is to temper expectations of yourself and others. So cut down your daily objectives at work and at home. And remember that, especially during a pandemic, a pristine home, it's usually not worth it. I often tell people that, if you are completely caught up on your laundry, take a moment and think about what cost that might have come at, and that it's easy to kind of focus on these things or feel like you're never caught up or your house is such a mess, but those are not the things that matter right now. So really kind of lowering your expectations either across the board or in parts of your life that are not super critical can really give you a little extra slack for coping with the things in the parts of your life that you really do want to be focusing on right now. Also, taking care of your body cannot be undervalued. Sleep is critical. Eating balanced meals is really important and often tough during the holidays. Also, stretching and exercise. I think especially without commutes and people walking around as much as they had before, it's easy, and especially during winter months when the weather isn't that favorable, it's easy to kind of let some of those things slide. But even quick little stretches or a 5-minute walk around the block can do a huge help. Scheduling time to unwind and take breaks is also huge. And I've had a lot of conversations with people about this because people oftentimes, like if they're in shelter in place orders and they're not traveling as much, they are saving time on a commute. But where's that time going? Oftentimes it's into homework or work or chores, but that's time is kind of like extra time people are getting back. So thinking about devoting at least some of that to taking a break and unwinding is key. And then another huge thing that I've been recommending to people is to have a scheduled time each week, like an actual chunk of time, like an hour or more, where you can kind of just focus on you, and whether it's giving your friend a call and catching up, or doing an online yoga class or anything like that, where it's just for you to unwind and take care of yourself. It's tough to get that going and to kind of relieve yourself of the guilt or logistics. There's actual barriers into doing that, but it's super well worth it, and it's an investment in your mental health. Also connecting with others and discussing how you've been feeling and how they're feeling. And then I really encourage people to contact their healthcare providers if it feels like your stress is getting in the way of doing daily activities for at least several days. So I also want to mention that there is an added level of stress often related to worrying about COVID and diabetes. And I just wanted to clarify that one of the best ways to kind of cope with those kinds of worries is to try to read up and stay up to date on the facts. And so, and I have a website for this later on if you guys want some online resources to just check in with or read in more depth. But so I just wanted to clarify that there is no evidence that living with diabetes in and of itself increases the risk for contracting COVID-19. So that means that someone living with diabetes is just as likely to catch COVID as someone who is not. But there is evidence that there's a higher risk for developing serious complications among people who already have COVID if that person is living with type 1 diabetes and has been having consistently elevated blood sugar levels, or a comorbidity, which is a second medical condition like obesity, heart or kidney issues, or lung disease. So that meaning, like the takeaway here being that people living with type 1 diabetes, that is what people refer to as well managed, are not found to be at increased risk for complications. And I think this distinction is important because, there is just a lot of anxiety about catching COVID in general, but clarifying how that relates to diabetes can kind of help. So how can we kind of manage all these worries for ourselves and our families that are going on right now? And this is kind of expanding on those coping strategies, but specifically for these kinds of worries. The first thing I recommend is to take stock of the situation and focus on safety and basic physical, mental, and emotional needs. And then consider putting tasks or other priorities that aren't really priorities to you at this very moment on hold. So letting the laundry pile up is a great thing to put on that, like put on that hold list. Going for the easy weekday meal options, that's a great thing to do to kind of reprioritize. And that being said, like if you're considering like, oh, my child, I've really wanted them to kind of take extra charge of this aspect of diabetes management, or they've been checking this many times a day, but I would like them to check this many or be in charge of these alerts or things like that. Those I often think it's a good thing to consider about if that is really a priority right now. How stressed are you? How stressed is your child? And is making that kind of shift towards independence, is this the best time for something like that? Not to say that it's not, but it is important to consider in the bigger context of what everyone's kind of dealing with in that moment. Also, consider establishing as much of a daily routine as possible. And try to regularly check in on your own and your family members' distress by simply asking, like, how are you doing? And asking yourself, how am I doing? Just to kind of see where everyone's at. And those kinds of discussions can help you kind of make decisions about what to prioritize and what not. And then regarding balancing the needs of your family and yourself, this takes constant assessment and reassessment and rebalancing of everything. And boundaries are really critical, but they're constantly changing right now. So figuring out like on a certain day, like what's your needs, what's your partner's needs, and how, what's your family's needs, what are your friends' needs, and figuring out that over the long term, those needs to be balanced out, even though on certain days they might be a little bit unbalanced. And then regarding supporting children emotionally, this is a really tricky time for doing that. But one of the most important things you could possibly do is to take the time to talk with your child. And then if they have questions or if you want to share information with them, try to do it in ways that are developmentally appropriate. And if anyone has any questions about this in particular, feel free to ask them, because I know that that's a super vague term, like what's developmentally appropriate. So I have a couple examples, but if there are any particular topics that anyone wants to talk about how we would discuss that for certain age groups, please feel free to enter it into the chat or Q&A. But for one example is for children, letting them know, like, because we want to keep ourselves and our loved ones safe from coronavirus, things are going to be a little different for a while. And I like to kind of start at a really broad general place and then see what the child's questions are and kind of follow them regarding the level of detail that I go into, but then making sure I stop at a place where I know they're not going to understand and or it's going to cause undue anxiety. For teens, I'd like to say things like, a lot of people are getting really sick from coronavirus right now. So for ours and other safety, we need to be extra cautious. And then again, for them, kind of letting them take the lead on how much detail they want to go into or how much they even want to discuss those topics. I really encourage parents to limit children's exposure to news coverage because they might misinterpret what they hear and see. And then also to closely monitor teens' activities outside the house to minimize risk and make sure everyone in the family is on the same page. And one of the things that I think is really a great opportunity for everyone is for parents to be a role model to their kids. Share what coping strategies work for you, and kind of, even if that's not what they take on, them seeing you actively using these coping strategies of taking time to yourself or, reprioritizing, that is a really great message to send to them and a model for them to follow. And then also, like I mentioned, consider diabetes related demands within the broader context. If it feels like there's too much demand being placed on someone within the family, consider how that could possibly be redistributed, even if it's temporarily. There's nothing right now that is like, everything's kind of in motion right now. So it's a good opportunity to make exceptions and try new things. And that's one of the things I've also been recommending with people. If you've been curious about certain technologies or wanting to try different kinds of diabetes devices, if you are in a situation where everyone's home a lot of the time, that's a great opportunity to try it out. That way, you have a little bit of extra of a safety net of having extra ears and eyes in the home while trying out something new. But it also gives everyone an opportunity to see how it goes. Like, what are the pros and cons of using it? And it tends to be a lot easier too when people are within the home, because then you don't have to worry as much about like the school personnel being up to date and what role they'll be playing in management, as it might be changing during that time. So also, some of the recommendations I have for kind of daily routines and distance learning is that routine is key. And whether you're talking about with kids or not, we all do much better when we have a routine, our minds and our bodies and our spirits. So it's good to, like, if you're talking about with kids, what I really recommend for parents is for you to decide what essential activities need to happen every day, but then let the kids help decide the order of those things and the timing of those activities. That way it gives them a sense of control and participation, and more importantly than anything, buy-in. Because if they're helping design the plan, they're more likely to follow it. And then really maintain consistent wake and bedtimes, which is critical for you and for them. There has research that's been done that says that maternal mental health, so mothers' mental health, tends to be better when their children have earlier bedtimes. I bet you guys could imagine a few factors that might play a role in that. And as for younger children, experts on child development have shown that basically for kids under the age of 7, that informal education is more beneficial than formal. And so trying to incorporate learning activities into daily family activities like cooking or folding laundry is actually going to be more beneficial for them than like sitting and having them do a workbook or some online learning activities. And on that note, it's also important to acknowledge that child development experts also say that for kids that young, you really can only expect them to have sustained, which means like focus and maintained attention on a task for 15 minutes. And so I know there are kids who are doing distance learning that requires them to attend to Zoom for a lot longer than that at those ages. So, providing them with breaks, and encouraging them to stretch and just being really, really compassionate if you know that what's being asked of them is not something that's really like the best for their learning at this time, and trying to show that support and empathy as much as you can. And also encouraging independent play. I think one of the things that parents often overlook is that when kids are playing nicely amongst themselves, we're like, sweet, this is great. Let me focus on all the stuff I need to get done. But it's a really great investment in keeping that going in the future to just take a half a second to say, you're doing a great job playing quietly, or you're building something awesome with those Legos, great work. That way that can kind of continue to encourage that over time, which is really great for everybody. As far as older adolescents go and young adults, they do benefit from remote learning because it gives them an opportunity for increased autonomy and opportunities for self-pacing, which are actually really important skills to develop. But it's important as a parent to try and avoid negative cycles of like trying to support and then feeling like you're nagging them and like, well, when are you going to get your homework done? Or are you done with that class yet? Because those can end up kind of setting a really challenging tone and then gets into a power struggle, which no one ends up really winning. So instead of that, try to just check in each day and see how things are going. And if you can, try and separate really those check-ins of listening and trying to understand what they're going through without reminding or problem solving or telling them how to fix their problems, because having those conversations will give you the information you need to actually come up with a compromise or a way to better support them moving forward. And I know that that's super tough as a parent, because if they're complaining about like, well, I'm getting a D in this class because I'm not turning in homework, and you just want to tear out your hair and say, well, then why aren't you turning in the assignments when I say, or why, when I ask you to do it, you don't do it right away? You wouldn't be getting a D. Well, you know, those conversations of really understanding what the barriers are for them and why it's not working on their terms, really being open and listening to that will give you all the pieces you need to actually be helpful in that situation, as well as devise a plan that will elicit their buy-in. So I think a big question right now is, how am I supposed to juggle work, school, diabetes, family, mental health, physical health, all of these things? Well, I mean, spoiler alert, which you guys probably know, that balancing all life demands during a pandemic is rarely, if ever, possible. And the truth is one success in doing that 100% is determined by how you are defining juggling. Does that mean that you still have a job, or does that mean that you're excelling at your job and breaking barriers every day? Same thing with school and diabetes and family. And really figuring out, like, what is my expectations in each of these areas? What's the bare minimum that I feel like is good enough? And focusing on that rather than trying to surpass all expectations or that you might, or standards that you might have had in the past. And the most important piece to all of that is you can't pour from an empty cup. And I think this is something that is easy to forget during a pandemic and, you know, during a new year where we're thinking about like all these aspirational things. But we really need to figure out, the first most important thing is, how do you make sure your cup is full before you try to pour into everybody else's and into your own work and things like that. And, you know, what oftentimes working with parents, I kind of describe it as when you're on an airplane and they discuss putting on the air masks, they always instruct adults who are with children to put their own on first. And it's for the same reason, which is you're not very much good to take care of anyone else if you cannot function yourself. And so, you know, self-care is not indulgence and it's not selfishness. It's really, you know, taking care of the machine that keeps everything moving. Oh, that's really great questions. Here, let me get through some of these slides a little bit first and then circle back to those questions if that's all right with you guys. So just on that note about balancing it all, like I mentioned earlier, prioritizing and reprioritizing regularly is really the key to this. You know, and taking a bottom-up approach instead of a top-down approach is really helpful. And even if it's just temporarily. So bottom up meaning, what is the bare minimum I need to do to get by with diabetes or with parenting or my job? And then working up from there, as opposed to starting at the top being like, what would it look like if I was absolutely killing it in all these areas of my life and everyone thought I was the best at everything? And just remember that everything's dynamic. So this prioritizing and reprioritizing just needs to be, it will be ever changing. Also, another key is to acknowledge uncertainty and to limit worries about the future and to limit planning. A lot of the families I've worked with, they live far away from their families. And so they're trying to figure out trips to go visit their families, but there's so many balls in the air regarding, you know, when is it safe to travel? What are the airlines doing? You know, what's my family going to be comfortable with? So creating those long-term plans ends up just kind of being a really stressful activity. And especially with kids who like to think of things very concretely, when they see that it's hard to come up with that plan, it can make them anxious or demoralized. So trying to worry about those things, it's better to just put it on hold and to, like, you know, pick a time point. So, okay, by the end of February, we'll at least have a discussion about when we think we could start making a plan, something like that, to just postpone it a little bit until you have a little more information. Also, try to set small attainable goals for each day or week. And then practice self-compassion, really acknowledge all of the stressors in your life and what you're dealing with and the toll that they're taking on you, and take that into account as you are making decisions and potentially evaluating yourself on how you're doing, because that's what self-compassion is. And then connect with others who have similar jobs as you, or stressors as you, or values as you, or households. Because I think right now, it's often people are having very different reactions to things that are going on. But if you know someone in your life who maybe is dealing with young kids in a similar situation, that can be a great person to kind of discuss things with, or that has similar values to you of what they're trying to achieve right now. And just remember that everybody is different, and there is a line between empathy and sharing and commiserating. But the truth is any connection right now with other people and acknowledging what other people are experiencing is a huge benefit to everybody. So acceptance is key. So there are no good decisions that can be made right now, only less terrible ones. And I think it's important to acknowledge that, because I think a lot of people are struggling to make these decisions and be like, well, what's the best decision? How do I know what's the best decision? And there really aren't any. So acknowledge that at the outset, and then just accept that you're just choosing a less terrible one in the end, no matter what you choose. Also, another really important piece of acceptance is to try and focus on gratitude. Now, this does not mean like, well, I shouldn't be stressed out because people are dealing with way worse things than I am. That's not the idea behind gratitude. It's more of a check-in with yourself and others about something that you're actually grateful for, and not in a guilt-shaming way, but just genuine gratitude. You can identify new things that you've learned or tried during the pandemic, like maybe a new meal that you cooked because you were trying to clear out the pantry and you saw that there was something there, or a new family routine that you might have started with your kids, or just catching up with an old friend on the phone. And then if you are religious or spiritual, utilizing those supports and guidance can be especially helpful during this time. And I think sometimes we overlook those pieces that can provide us a lot of comfort and acceptance. So what if things are going pretty well, but you're wanting to make some positive changes or move in a certain direction? Well, my biggest advice here is to avoid drastic shifts and all or nothing thinking. And these are my kind of qualms with the traditional New Year's resolutions, which they tend to be drastic and all or nothing. Like, I am going to give up refined sugar for the year, or I'm going to exercise every single day. Okay, that's really hardcore. And, I talk with my patients all the time that there's a reason why the gyms are filled in January, but not the rest of the year. And it's because people kind of set themselves up, and then once it doesn't work out, then it kind of goes back, but then there's this added guilt and shame around it. So what I really encourage you to do is to meet yourself where you are at in this moment. What do you want? What can you do? What do you want to do? And then a strategy that we often use is this idea of using SMART goals. So generating goals that are specific. So like, instead of I'm gonna, work out as much as I can, saying I'm going to walk 3 miles per day, 2 days a week. And then something that's measurable so that you can actually gauge your progress. Some people will have goals that are just kind of like, well, I'm just going to worry less about the future. That's not exactly measurable. And it's hard for us to even keep track of our own worries. So thinking of things of like, I'm like, at least once a day, if I catch myself worrying about this, I'm going to try to focus on something else. And you can actually track that on a piece of paper. Things that are attainable. So this is meeting yourself where you're at, based on your abilities and motivation, interests and passions and all of that right now. And then being realistic. So, what's doable based on the situation. And lastly is timely. So set a time frame for achieving it. And I think this part is really key. And that time frame is nice because you will get a sense of satisfaction, as opposed to this idea of I'm going to exercise as much as I can this year. It's, that's not really that great. And there's no point before an entire year passes that you can feel like you've achieved your goal. So I really encourage to set a time frame, and that at the end of that time frame, whether it be like a few weeks or a few months, to assess, for one thing, did you achieve the goal or not? But then for another thing, to either, if you didn't achieve it, figure out why, what were the barriers, and reevaluate that plan and adapt it or throw it out. Or if you did achieve it, that's a great opportunity to think about, well, do I want to keep this going or not? And, or do I want to expand upon this? And what did I learn about what went well and what didn't to inform that? So that way you get that satisfaction, and then you also get an opportunity to actually use the information that you've learned from trying something new. Oh, a couple other tips I wanted to give about trying out new things or positive changes. One of them is anchoring. So timing the new behavior with other events or tasks in your daily routine can be really, really helpful. So for instance, like if you wanted to do something like, check your blood sugars one extra time a day, or add in a stretching routine, try and time it with brushing your teeth. If it's something you want to do every day, or if it's something you want to do once a week, try and do it on trash day. So that way you have these external reminders and a time of the week that you can kind of anchor those new things to. So it's not kind of free falling and up to you to just spontaneously remember when you're supposed to. And then the other tip that is really helpful is something that we call activity pairing, where you can take the new, potentially less desirable activity that you want to start and pair it with a very highly desirable activity. So for instance, you could listen to your favorite podcast or watch your favorite TV show, but only while you're doing a certain exercise routine. Or, doing things like doing that extra blood sugar check right before you binge watch your favorite show every day, if you binge watch every single day, things like that. So that way you kind of add these two things together, and it really helps you kind of keep it going. And then, so just in closing, I wanted to say that a really important part of mental wellness and well-being is pursuing meaning and connection, which can be very challenging, especially during this past year. So thinking about this coming year, I encourage you to consider, what are some ways that you can connect with people who are facing similar stressors or have similar values as you? Consider contributing to a cause that's meaningful to you, either with donations or volunteering, or really just learning more about organizations or causes that matter to you. And then also just small random acts of kindness, finding ways to let someone know that you've been thinking of them, or to do something nice or spontaneous or anonymous for one of your neighbors. And really, more than anything, is to pursue something that's meaningful to you based on your beliefs and values, and make sure that you incorporate that into your life. So I just wanted to provide some resources here at the end, and then really spend the rest of the time opening it up for discussions and some of the questions that came in. But if you are experiencing stress beyond what you feel like you can cope with, or like I said, if it's impairing your ability to manage daily activities for several days, then I encourage you to let your healthcare provider know. You can also call the number on your insurance or health plan to identify mental health services within your network. If you have any substance use concerns specifically, there's this website, and also a national treatment locator hotline that you can call. Also, I wanted to provide these hotlines and text lines for disaster distress, suicide prevention, crisis in general, and then also national domestic violence hotline, because domestic violence has increased since the pandemic began. Also, there's this wonderful app that has come out from the VA that they've made available to everybody, which is what they call the COVID Coach, which is based on other apps that they've developed for other specific things. But this is really to help people cope with COVID and the stress related to it. And it provides some great tips and tricks, and just kind of helps you monitor your own distress. And then I want to provide some websites here. Right here is the one from JDRF, which has some diabetes specific facts related to COVID, as well as in general, because one important way to cope is also just to be up to date on what the actual risks are at this time, and how to manage anxiety and stress through that. And thank you guys so much for having me and for joining today. I'll look forward to this discussion.
Thank you so much, Jessie. That was spectacular, and I appreciate the approval of having my laundry piled up. So I think let's go ahead and get started with some of the questions that came in. So someone asked about an assessment for use with kids that you use at Stanford.
Yeah, so I'm not exactly sure specifically what the question is hoping to assess, but we do use we're rebooting our screening that we use to screen for depression, which you can also find online. It's called the PHQ-9, which stands for the Patient Health Questionnaire 9, which you can just Google it really quick, and there's all these websites, and you can fill it out for free. And it just has 9 questions that assess for depression. And it doesn't, like, basically we use that as a screening tool and it will let you know if you're above the cutoff for what they think requires mental health treatment. There's also the diabetes distress scale, which is developed by our colleagues at UCSF, which is a great short similar tool for assessing diabetes distress, and also to help, they have cutoffs as well for when it would be helpful to get additional treatment or resources. And I believe that is available online as well. And they have various versions of various lengths, but those are nice, quick, easy assessments.
Oh, I'm not sure if it's my internet or yours.
But if there's other types of assessment that you guys are asking about, like, let me know, and I can, like, for anxiety or other stuff like that, let me know and I can share.
That's great. Thank you for those resources. It's really nice that they're available online as well. And so one of the other questions was, how do you communicate your concerns to your family without adding to their stress?
Yeah, I guess, I mean, I bet, so concerns about COVID or concerns about self-care?
I'm presuming it's sort of concerns and stress. So like, what if you're needing to ask your partner for help, or, parents for help with kids or things like that?
Okay, great. Yeah. So each one of those, I actually think I would have a slightly different response for. So it's a little bit tricky. Like, for instance, if it was concerns about like school, like, I do think this is such a wonderful question, because we're all worried about adding to other people's piles. Like, my number one question for my friends when they call me in tears and I'm like, how have you not told me that you've been so upset this month? And they're like, well, I didn't want to add to your pile. And I think that in and of itself is really, really important. No one wants to put undue stress on anyone else, but the truth is no one's instincts have them doing that. I think letting other people know that you're overwhelmed or you have concerns about things in and of itself does not add to other people's piles. I think if you frame it in a way of like, well, you're not doing enough around the house, and so I'm stressed out from the laundry, that's a little bit loaded right there. But saying, I'm concerned about the housework and how to balance that with school, and I'm not sure that the kids are getting everything done that they need to, that is a lot more general and out there and can be a gateway to a productive conversation. And I also think, concerns and stressors related to like COVID or self-care, I think it's good to have that on a need to know basis, like, especially with kids, that you don't want to put too much on their plate and definitely shield them. But I think one of the most challenging things for people to do is to let someone know that they have a need and ask for them to fill that when it's not something that's a routine part of that relationship. So when I do work with parents and I ask one of the parents to please take this like hour or two to themselves once a week at a set time, and they know they can have it, like the initial response is, I do not know how to ask my partner for that. I don't even know what I would say or how they would respond. And like, how does this add to their workload? And I asked them, what if your partner said that to you? And they're like, well, of course I would do it. And I think that's kind of the mindset, this idea of like self-compassion. First, accepting for yourself your concerns and stressors, and then figuring out, okay, well, what do I need to communicate and how should I best communicate that to make sure that the outcome that I'm needing or that I feel like is important right now can happen.
Yeah, it's great advice. And again, like you mentioned earlier, you can't pour from an empty cup. And I think it's really important for everybody to take that advice. So for the next question, how can people with diabetes discuss their COVID specific concerns with people who are feeling like the virus isn't quite as big of a deal or are not on the same level of concern?
Yeah, that is a tough one because I feel like that compounds two different things that are going on right now. One is everybody has a different assessment of risk right now. Absolutely every individual. And that is hard. So when you say, I don't feel like this is safe, someone else might say, what are you talking about? You're crazy. That's totally safe. And then similarly, I think it's a very common theme in diabetes that people who do not live with diabetes, don't have experience with that, really don't understand what that means. And so I think kind of putting those together and saying, like, well, I have these concerns about risk and trying to convey that to other people is really challenging. And I don't think there's a great way to do that because the truth is we cannot impose our ideas about risk on others for better or worse. But I think coming from a place of, you know, sharing what you need to share, I think that, and it's similar with other aspects of diabetes as well, like sharing what you need to share to kind of get to an understanding with that person that you need to. And oftentimes I feel like the best way to go is taking a vague route. Because if you were to say, well, there's this research showing this, then you're kind of opening the door for a kind of debate about risk or the medical studies. Whereas I like to take an approach of, given my medical condition or my child's medical condition and what I've read about COVID and risk, these are the decisions that we've made, or this is what we feel like is too risky for us. And we understand that other people might not agree with that. If you have questions, I'm happy to talk about why we're making that decision, but really come at it of a place of just hoping for acceptance and to communicate knowing that you may not be on the same page as other people at the end of the conversation.
Yeah, I think that's great advice. I think it's challenging, it's multifaceted, and I think it's really about your personal story and your connection with people that helps, tell your story and your concerns, so, and your needs. And then what advice do you have for people with diabetes who are seeing diabetes control concerns as a result of stress? So people that are having high blood sugars or erratic blood sugars during times of stress.
So yeah, that is tough because like one of the things that we know is that the people who are at greatest risk for having mental health issues during a crisis or pandemic are people who have had mental health issues in the past. And and then there is this whole issue of like, it's kind of this very awful cycle of worrying about, well, I know that the risk for complications of COVID are worse if my blood sugars are out of control, as I say, but then the stress over that might make your blood sugars be more challenging to manage. And then around and around the cycle goes. And I think the most important thing to do is to just try and take a step back from that cycle and to try and figure out what part in there is going to be the best place for you to try to interrupt it. Whether it's, I'm going to try and practice self-care and give myself breaks from worrying about, it's diabetes vacation per se. If you have someone in your life who you can just say, hey, I want to hand over the reins about worrying about my alerts or my blood glucose levels for just a little while. And I'm just going to like watch this terrible TV show or go for a walk or do this yoga class or any of those kinds of things. Give yourself a break from thinking about it altogether. And even though that doesn't completely control your thinking the rest of the day, it lets you kind of break up that cycle even for a moment. For other people, it can be something as far as like, trying to do a relaxation strategy or anxiety management strategy when you notice your blood sugar levels are high or those alerts go off because you want to interrupt that cycle. And I think, self-compassion and forgiveness is a big part of that because oftentimes those numbers feel like they have judgment or shame or guilt or weight on them, which perpetuates the cycle of stress, but one of the things that we have learned a lot in psychology is that when you do have a physiological response to stress, sometimes our mind places meaning on it that isn't really there. So, accepting, hey, when I hear this alert or when I see a number at a certain level, I know I'm going to stress out, but I'm going to preemptively tell myself that I'm not going to worry about why it happened or beat myself up over what I ate or when I pre-bolus, and I'm going to save that problem solving thinking for the next morning or a couple hours later, and kind of coming up with different routines that work for you to just interrupt that whole cycle.
I really love that idea. I actually, I also live with diabetes, and I changed my high alert on my Dexcom to be a fun one so that I kind of dance when I hear it, just so that it doesn't piss me off as much. And, my husband actually, he follows my Dexcom, and he, instead of asking me what my blood sugar is or what happened, he'll say, BG, my beautiful. And it's like the nicest way for someone to ask you what your blood sugar is. And it just really helps take the edge off. So anything you can do to take the edge off, I'd highly recommend it.
Those are such perfect examples, because it's like, at first thought it might be like, oh, that's silly, like just a silly little song coming on, but that's exactly what it does. It interrupts the cycle, and it's just like some of our research shows that if you walk around smiling all day long, it prevents negative mood. Make it till you make it, doing anything that just takes your mind off it, lifts the mood up a little bit, adds a little bit of positivity, and whatever meaningfully does that for you is something that's at least worth trying. And even if it doesn't work, then at least you have a little bit of information about what helps and what doesn't. You can try something else, but it's unlikely for things to get worse.
Yeah, that's great. And so for the last question, what if I had existing mental health concerns and am crumbling under the combined pressure of COVID plus previous issues? How can I take care of my mental health even more?
Oh, such a great question. And I really love that, because the truth is everybody is crumbling right now. And I think the first step is to acknowledge that and to just practice a lot of self-forgiveness around that, because I think a lot of people see everyone else like on Zoom meetings or on phone calls or on TV, and it's like, well, everyone else is doing so great, but I am crumbling. And the truth is it's a really, really hard time right now. And like I discussed in the presentation, I think, reprioritizing is key. And regarding like your own mental health, really trying to figure out, have I reached a point where like this is more than I can manage by myself? And there's absolutely zero shame in that. And then reaching out to someone, whether it's a mental health provider, which I, strongly recommend, even for people who are not feeling like they're crumbling. All of us can benefit from it, but a mental health provider, a spiritual leader, even a friend, just to reach out to someone and let them know how you're feeling and what you're dealing with. And, like I said, reprioritize about what the pieces are for you. Like, what's one part of your life that really matters to you, that you find value in, that you feel like, is it either can be okay or is okay, and just reminding yourself of that. And this is a lot. And I think the uncertainty of it all is really tough, because it's easy enough to say like, my life is falling apart, but this pandemic's gonna be over in a week. And so, it doesn't weigh on you as much, but I think that uncertainty piece is tough. So having concrete supports in place. And like I said, reaching out to a mental health provider is never a bad idea. And regardless of, and the one thing I do want to say about that is the match between a provider and a patient is the most important thing. So if you've been to a provider that you didn't really like that much, or if you meet someone who didn't go that great, please don't let that deter you from reaching out again in the future, because it's just all about that match, and you don't know until you meet someone whether it's there. And I really do guarantee that everyone here is doing a ton more than you give yourself credit for. And so your crumbling right now is still an astronomical feat. The fact that you're even here right now, to try to make things better and to like learn about mental wellness in this new year shows that you are absolutely a champion. And I think it's just a decision about, what you want to do with the resources that you have, and how you can kind of keep that champion spirit and energy going so that things do start to continue to get better.
I really, really love that. What a great way to end this webinar. I mean, I think just to everybody out there, we have all struggled in this pandemic at one time or another. And, you matter, you are important, and please ask for help if you need it. There's no shame. There's no shame in seeing mental health providers. There's no shame in taking medications. It's all just part of taking care of yourself. Just like we take insulin and check our blood sugars, it's the same thing, just a different part of the body. So thank you so much, Jessie. That was fantastic. I always love hearing your talks. You help me feel reinvigorated and ready to take care of myself for the next year.
Well, thank you so much for having me. This was such a pleasure. And, I wish like I said, everybody here is absolutely a champion, and you are very high functioning and strong to even be here right now in the midst of all of everything that's going on. And, I wish you all the best. And if there's anything more I can do, feel free to reach out. Yeah, thank you so much.
Yeah, well, thanks everybody. And we'll see you in a couple weeks for our next Screenside Chat. Thank you.